Good afternoon, everyone. This is Dr. Ray from Bradford Family Chiropractic. I'm here with Chase, our former intern. We're going to be showing you a quick active release for the deltoid region. So the deltoid region is going to terminate right at the deltoid tuberosity. So he's got a good developed deltoid, so we'll have really good access to it. So what we're going to do is we're going to put a nice loose contact with our thumb on the deltoid. Now, in order to flex the deltoid, we're going to bring it back overhead. I'm going to make my contact with my other hand, and then we're going to bring my arm down, and we're going to try to rotate it slightly behind his back, although he's got a little range of motion limit. We're going to come back down again. We're going to do maybe 4 to 6 passes, working that anterior deltoid. So ideally we want that arm of his to come down and slightly behind the back. Our model in this case has got a little limitation in motion. So again, we're going to get to that deltoid tuberosity. We've already worked our way up the chain, and now we're going to go a little further. Now we're careful right where we are. About halfway up that deltoid, we're going to get really close to where that subacromial bursa is. So we want to make sure this is comfortable for the patients. We're going to move up that chain again and down. That's not too much for you, sir?
Nope, all good.
Wonderful. And we're going to bring it up now. All right, so I'm going to have you sit up for me. So we're all aware that there's more than just the anterior deltoid going on, if you can move here. So right now we're going to try to move more towards the middle deltoid or the lateral deltoid. It's going to be done in much the same fashion. We're going to raise up the arm. We're going to make our contact down at the deltoid tuberosity, and we're going to have the patient bring the arm down and slightly around the back. So we're going to come up here. We're going to get to the insertion of that medial deltoid, hand here, and we're going to bring the arm down. Wonderful. Not too painful?
Nope, all good.
We're going to go nice and slow. Wonderful. Especially hold that last beat. Again, nice loose contact with the hand, putting most of my force through my, in this case, the inferior hand. Now, we could just as well use the opposing hand, but that's going to kind of get us in trouble over here with a patient of the opposite sex. So in this case, I would rather use my superior hand to make the contact, and this one's giving it the support. Now, last but not least, we're going to work the posterior deltoid. And for this one, we're going to have the patient turn slightly to the side. And the motion of the posterior deltoid, this is kind of the contracted posterior deltoid, and the motion for the patient is going to be bringing it down and across the body. So we're going to get that posterior aspect of the deltoid, and we're going to bring it up. We're going to go high with the elbow, and we're going to come on down, and we're going to work our way around to the front. And we're here making our contact, making sure that's not too pinchy for you, sir.
Mm-hmm. Good.
Wonderful. And we're coming down. And we're bringing that shoulder around, working our way all the way back to that posterior shoulder capsule. All right, so that was a quick review of some active release or pin and stretch techniques for the deltoid portion of the shoulder. Dr. Ray with Chase, the ex-intern.